Members, it's the appointed time. We have a quorum. I call to order the meeting. Yes, let's get started. Agenda item number 1. Information papers issued since last meeting. The Secretariat has issued 2 information papers. Please refer to the agenda. Paper number 1. Referral memorandum from the Public Complaints Office of the Legislative Council Secretariat regarding policies issues relating to improving the spinal health of children and adolescents living in inadequate housing. And the other paper is from Mr. Michael TIEN on matters relating to the Tin Shui Wai Hospital expansion project. Agenda item number 2, items for discussion at the next meeting. The next meeting will be scheduled for the 14th of April at 10:45. We will discuss number 1, update on the elderly healthcare voucher GBA pilot scheme, and 2, progress on establishing the Institute for Medical Advancement and Clinical Excellence. Any views from members? If no, we will discuss these 2 items at the next meeting. Thank you, members. Agenda item number 3, development of Chinese medicine. Please invite the administration to join us. This agenda item relates to legislative proposals, so all members of the council are invited to this agenda item discussion. I believe a lot of members will speak, so I will keep time limits. Please allow time for the administration to respond to your views. Please allow at least half of the time. If possible, I will allow members to speak in the second round. If you used up all the time, the administration may not have enough time to get back to you. If members wish to speak, please press the button to request to speak. I will now invite the administration to take us through the papers. Good morning, Chairman. I will brief members on the latest policy initiatives in relation to Chinese medicine. Please be quiet. Secretary, the floor is yours. The government has been promoting high-quality development of Chinese medicine. Resources have been devoted to different policy initiatives in recent years. In 2025, this is an important year for the development of Chinese medicine (CM). It will witness a lot of breakthroughs as well as opportunities. At the end of this year, the government is going to issue the first Chinese medicine development blueprint, which outlines the vision as well as the strategies in this regard. We are conducting consultation with the industry. We have set out the major development directions. 1, establishing a comprehensive CM governance framework and service system. 2, strengthening the role of CM in primary health care, for example, to explore enhancing the role of CMP Chinese medicine practitioners in providing services for chronic disease management and diseases in which CM has an advantage through strategic purchasing. 3, further leveraging the therapeutic advantages of CM and integrated Chinese Western medicine ICWM, and strengthening the cross-disciplinary understanding and collaboration between CMPs and other healthcare professionals. 4, ascertaining the core competency assessment standards and training pathway for CM undergraduate education and advanced professional training in order to formulate a professional development system for CM personnel. 5, reviewing the prevailing regulatory framework of CM for updating the relevant legislation and requirements. 6, driving scientific research and innovation in CM by capitalizing the platforms such as the GBA International Clinic Trial Institute. We will also facilitate elevation of the Chinese medicine industry and assisting local and mainland high-quality CM products to explore the overseas markets. fostering cultural inheritance, education, and promotion of CM extensively, and utilizing Hong Kong's international status to promote CM management standards, service, and education system models to the world. At the same time, GCMTI and the Chinese Medicine Hospital will be commissioned in phases starting from the end of this year. Upon commissioning on the CMH, it symbolizes the progression from primary to tertiary healthcare system in Hong Kong. It will also assume the role of research, teaching, and the creation of health value. The Chinese Medicine Hospital will work with the Hospital Authority, 18 CMCTR. They will foster closer collaboration ties. GCMTI will be responsible for teaching, research, as well as international collaboration. There will also be standards and assessment methods and knowledge transfer programs for CM. The aim is to develop the brand of Chinese medicine in Hong Kong. We will develop a set of internationally recognized reference standards. There will also be talent training, CM standard, as well as herb-drug interaction. There will be more large conventions and mega events in relation to CM. They will be held in Hong Kong. In 2025, there will be the 7th GBA Conference on Inheritance, Innovation, and Development of TCM. There will be different representatives coming to Hong Kong. They will together witness a number of important milestones in CM development in Hong Kong. The 20th Third Plenum was about deepening the reform and moving towards modern China. We need to leverage on deepening the reform of CM, on setting standards, clinical research. We have the advantage of having the staunch support of the motherland and enjoying connection with the world. We act as a bridgehead for promoting the internationalization of CM. We have settled the details of the main points of other developments in relation to CM in the papers. My team and I are happy to take questions from members. Thank you, Secretary. We have Reverend Peter Kuhn, Dr. Tan Yue Hung, Professor Chen Wing-kong, Mr. Benson Luk, Ms. Rebecca Chan, Ms. Connie Lam, Mr. Chen Kim-por, Ms. Judy Chen, and Ms. Dr. Starry Lee. 4 minutes for each member. If you want the administration to respond to you, please allow time for the administration to reply. If we have sufficient time, I will allow second round. Reverend Peter Kuhn. Thank you. In 2014, there is a pilot scheme in relation to ICWM. There are 3 main designated disease areas, and in early 2023, the pilot schemes was regularized. 3 more areas were added to the pilot scheme. Among these 6 disease areas, how many patients have used the program? What are the percentages? We have an aging population in Hong Kong. Will the government explore extending designated disease areas to a wider range, such as dementia or other geriatric diseases? Thank you. I will ask Dr. Cheng from the HA to reply to your question. Thank you, Chairman. Thank you, Member, for your question. We have 3 designated disease areas: 1, stroke care; 2, musculoskeletal pain management and cancer palliative care; They have been in operation for a long time. From 1,400 to 3,700, the programs have been in operation for about 10 years. The pilot scheme has been in operation for 1 year or so. There are cancer care, respiratory diseases, and knee osteoarthritis care. About 100 patients. They were launched not long ago. We hope to expand the number of clusters from 4 to 7. Any follow-up, Reverend Peter Kuhn? Well, I'd like to ask about geriatric diseases. Dr. Cheng? Can I have your question again? Well, I mean, will you cover geriatric diseases in the ICWM services, say dementia? For our future strategies, there are a total of 50 advantage areas. They are backed by evidence. They are proved to be effective. For geriatric diseases, they cover dementia, for instance, diabetes, dementia. These are areas we want to look into, but we'll have to wait for another year after we have taken stock of the ICWM program. Thank you.
Next member, Dr. Tan Yuehen. Thank you, Chairman. The government work report delivered by Premier Li Qiang during the third plenum mentioned that we need to deepen reform on an inheritance mechanism for Chinese medicine and promote the internationalization of Chinese medicine. We need to attach more importance to Chinese medicine in the coming few years. We need to have a talent pool on enhancing the industrialized developments of Chinese medicine in terms of storage of materia medica and also service delivery. I'm pleased to learn that the Chinese Medicine Hospital will be commissioned soon. So I have two questions about the topic. In paragraph 31, Chinese Medicine Development Fund. So there were 2 rounds of injections, but there is only a total of 1 billion Hong Kong dollars. Now, with this amount of funding, 8,900 funding applications were received, benefiting more than 3 million members of the sector and the general public. And also 60 Chinese medicine clinics were benefited from the Chinese Medicine Development Fund. Now, the funding amount of $1 billion is meager in relation to its scope of service. Now, does the CMDF offer dedicated support or specified support to specific areas? With such a wide scope of funding projects, the support it offers is not concentrated. So in terms of the funding scope and the need to sponsor more innovative development of Chinese medicine, is $1 billion enough? Now, in terms of international collaboration, in Jiangsu, Henan, and Hubei, there are a lot of international medical activities happening in these provinces, and many of which would like to use Hong Kong as a platform to go global. So in terms of collaboration with mainland cities and provinces on promoting Chinese medicine, is there a strategy? Secretary, first on the CMDF, the purpose of the CMDF is to enhance the standard of the Chinese medicine sector as a whole. That's why the funding scope is wide. Dr. Tan is right that there is a wide range of funding projects, but I would not say that the effort is scattered. Now, in terms of development of Chinese medicine standard and training, the funding offers staunch support so that we can achieve better results in various areas. Now, in terms of our development strategy, I would defer to the Commissioner. Dr. Vincent Chung is formulating the blueprints for Chinese medicine development as we speak. Thank you. Now, when we are formulating the blueprints for Chinese medicine development, in terms of training, regulatory approach, standard setting, and promotion, the blueprints will touch on all of these areas. So the blueprints will align the CMDF with these purposes. Now, in the short run, the CMDF will be supporting the development needs of the Chinese Medicine Hospital. In particular, the fund supports two major projects under the Chinese Medicine Hospital. First of all, Advanced Chinese Medicine Practitioner Training Program in collaboration with the China Academy Chinese Medical Sciences. There will be clinical collaboration between Chinese medicine and Western medicine. There will be medical legal courses as well as other administrative programs offered to CM practitioners. In the future, we will continue to work with the National Administration of Traditional Chinese Medicine to train up more talents. Now, in terms of collaboration with other provinces, we have always had very close collaboration with mainland provinces and cities to offer training to our practitioners. Now, Hong Kong has a very sophisticated trade platform. We will bring our national products to the world in the future through our platform. Professor Chen Wing-Kwong, thank you. I represent the Chinese medicine sector in Hong Kong, and I would like to praise the government on several fronts, and I also have some suggestions to make. First of all, I want to praise the government for your staunch support for the development of Chinese medicine in the past 2 years. The last 2 years were our milestone. That includes the commissioning of the Chinese Medicine Hospital within the year and also the promulgation of the blueprints for Chinese medicine development. I want to thank the government on behalf of our trade. I thank the team, including the Permanent Secretary and also Dr. Zhang. Second, I thank society for accepting and taking on board my 3 proposals on developing Chinese medicine in Hong Kong. I thank everyone for taking on board my suggestions. Third, in terms of developing primary health care and enhancing Chinese medicine role in it, I have 3 suggestions. We need to introduce the Chinese medicine bill as soon as possible. That would be very important for providing a legal framework for the development of CM in Hong Kong. I hope that the bill will be passed soon to support the development of the trade. Second, we need a timetable for developing CM. 3, in terms of CM's role in primary health care, we need to establish Chinese medicine's role. So these are my 3 suggestions. So in the following, I have 3 questions. Now, the funding support for the 18 Chinese medicine training centers to $800,000. But still, it is very difficult to get a quota. Now, will the government continue to increase the number of quota places offered by these medicine? Now, the government's reply to my oral question, the government mentioned that certain Chinese medicine clinics would be reprovisioned to enhance the service quota. So what's the progress about that? Now, according to the primary healthcare development blueprint, the government would enhance the role of CM practitioners in primary health care. So what are the specifics? What are the future roles of CM practitioners? Now, paragraph 30 of the document, it mentioned that the government will support local and national proprietary medicinal products to go global. I support that. Now, we always say that we will leverage on Hong Kong's international advantage to help mainland Chinese medicine products to go global. So how exactly are we going to do that? Will you take on board the DAB's proposal to establish an international CM trading platform in Hong Kong and organize large-scale international events regularly so as to link up the markets? Now, once again, I thank the government for accepting the DAB's proposal on developing Chinese medicine industry in Hong Kong. So please give us a brief reply, Secretary. As I've mentioned in my opening remarks, the development blueprints for Chinese medicine to be promulgated in the end of this year covered several of the points mentioned by Professor Chen. That includes strengthening the role of CM in primary health care and enhance the role played by CM practitioners, in particular, in advantageous disease through strategic purchasing. And also point 6, leveraging on the capability of the GBAIC TI, the CMH, and also the GMCTI, and also facilitating elevation of the Chinese medicines industries by exploiting overseas markets. These are all covered. These will all be covered in the blueprints in the future. Next, Mr. Benson Look, please leave some time for the Secretary to reply. Thank you, Chairman, and thank you, Secretary. Now, development of CM in the past few years is attributable to the efforts made by the government and also the contribution made by the industry. Of course, the leadership of the Secretary is also important. In terms of the usage rates of the elderly healthcare voucher, some 40% of the vouchers were spent on Chinese medicine services. It shows that with the government support, more members of the public are making use of Chinese medicine services. Now, there are 4,551 Chinese medicine practitioners registered under the elderly healthcare voucher scheme. Now, the government has been promoting the e-health system. However, there are only 1,000 CM practitioners registered on e-health. So in terms of usage of e-health by CM practitioners, can the government do something to encourage more practitioners to come on board? Now, another important infrastructure is the Chinese Medicine Hospital. Now, as I've mentioned, CM services are becoming more and more popular among the public. Now, what about the fee charged by the Chinese Medicine Hospital for its outpatient clinic? Because I think that would be a concern for many elderly patients. Now, in terms of talent training for the Chinese Medicine Hospital, according to the paper, we are trying to build a talent pool, and we are all trawling for talents. So CM nurses are also an area of concern. Now, the government said that you would deepen the registration framework for CM nurses under the existing model of enrolled nurses. Now, the CMH will need some 200 CM nurses in the future. So have you started recruiting for CM nurses already? And what is the qualification and expertise required for the CM nurses? Secretary, for e-health, true, the onboarding rate for CM practitioners under e-health is rather low. And we have also established a dedicated program called the EC Connect. That is a e-health record sharing system among CM clinics, but only some 180 Chinese medicine clinics have joined the EC Connect. Now, we understand that the traditional operational model for CM clinics may discourage them from using an electronic health record system. So we need to promote and encourage the trade to embrace the change and join the EC Connect. Now, we are going to launch the eHealth Plus soon. So we hope that we can facilitate digitalization of health record among the CM trade. Now, in terms of the talent pool, recruitment of nurses, as well as the fee model for the CMH, I will defer the question to Dr. Zhang Wailun, Project Director of the CMH.
Regarding the fees of the Chinese Medicine Hospital, we have government-subsidized services, and they account for 2/3 of the total services of the hospital. For the remaining 1/3, they are market-oriented. They are not subsidized by the government. Fees will be decided by the Health Bureau. Regarding market-oriented services, they will be decided by the Board of Directors of the CMH. We are undertaking studies to consider the market situation as well as the affordability of the public. In September this year, we will announce the price levels of subsidized services and non-subsidized services. Members, please be assured that the fees will be affordable. Regarding work on the talent pool, we have recruited a total of 250, most of whom are CMP, Chinese medicine practitioners. In relation to nurses, we have used the Chinese Medicine Development Fund to undertake some nurse training projects. We will start 1-year-long nurse training projects. For nurses working in the CMH, they have registration in Hong Kong. They will further receive training on Chinese medicine services in order to discharge their duties. Upon commissioning of the CMH, we aren't expecting a lot of nurses required as we focus on providing day patient services, so we need around 20 nurses in the first year. We aren't expecting any recruitment difficulties. Ms. Rebecca Chen, thank you, Chair. We are glad to see the commissioning of the CMH. CM services are widely popular among members of the public. Regarding the CMCTR in 18 districts in Hong Kong, the usage rate is very high. CM helps a lot in relation to primary health care. For many non-profit-making organizations, there are CM mobile vehicles. Some senior citizens have mobility difficulties. They can use these mobile trucks. Will the government use more CM mobile trucks? Can we provide more services with these CM service trucks? In 2018 policy address of the Chief Executive, Chinese medicine are covered under the Health Bureau. We have CMCTR across all 18 districts in Hong Kong. There will be announcements in relation to changes in price levels of CM services. At present, they cost $120. So is it possible that there will be price changes in this regard? And we need to be good gatekeepers in relation to the quality of CM services in Hong Kong. There were reports issued by the Office of the Ombudsman in 2018. There should be regulation over CMM being used as Chinese medicine. When there are elements of food or vitamin, then these CMM will not be covered. Is there any further information in order to boost the level of confidence among the public in CMM, Chinese Materia Medica? In relation to CM mobile clinics, indeed, to residents in some areas, they are convenient, and I understand there are organizations providing these services. But we need to factor in the efficiency, that is, whether efficiency will be affected. We may need more manpower with the provision of such services, as more manpower will have to be deployed from clinics to these mobile clinics. If we need to turn all outpatient clinics to mobile clinics, when it comes to efficiency and costs, we need to consider these aspects. Well, I'm not saying that we should turn all clinics into mobile clinics. I was saying that we could increase the number of mobile clinics. In relation to price, subsidies in relation to CM clinics aren't covered. We compare the prices of Chinese medicine services and non-Chinese medicine services. We'll draw reference from the subsidy amount in relation to CM services. Regarding the fact that only pure CMM will be regulated, we will study whether there is any further room for improvement. We will take these into account, and if need be, we will amend legislation. Next, Ms. Connie Lam. Thank you, Chairman. CM is popular in the public. Chinese Medicine Hospital, which will be commissioned at the end of this year in Cheung Kwan O, will be used by a lot of members of the public. I understand there is discussion between the insurance industry and the CM industry. What is the latest progress? Will CM services be covered under the VHIS? How much will the public have to pay when it comes to using CM services? The CMHO will be commissioned starting from this year. The CMHO will assume the role of training and education, research, and so on. There are some 2,800 or so CM. Well, I mean, there are 8,500 CMPs. Some say that these figures aren't updated. Some have already left Hong Kong, whereas some have already passed away. So do we really have 8,000 odd CMPs in Hong Kong? They work in both private sectors as well as the public sector. If some CMPs will work in the CMH, do we still have sufficient manpower? Do we have enough CMPs to be responsible for international collaboration? And do we have sufficient CMPs working in the public sector providing outpatient or inpatient services? We have over 10,000 CMPs on the list. For registered CMPs, 8,000 or so. We are conducting a study to update the figures. When it comes to CMH, indeed, this is the first time we have inpatient services in relation to CM. For hospitalization services, we do need manpower. So when it comes to this aspect, the CMH is actively recruiting manpower. We recruit from outside Hong Kong as well. We recruit talents to come to Hong Kong. Regarding the details about CMH, including price levels as well as insurance, I will ask Dr. Zhang to give you more information. We have held 3 meetings with the insurance industry. Price structures and other aspects, we have had sufficient consultation and collaboration. For the first year of the CMH, mainly inpatient services and day patient services, we have 128 hospital beds. So we are well prepared for the hospitalization services of the CMH. When it comes to manpower, as I already said, CMH has a core team, but the focus is on collaboration among different parties. It is a teaching hospital of 3 universities, so 3 universities will also send manpower to the CMH. We encourage talents to come to the CMH to provide services in honorary capacity and on a part-time basis. They may not be full-time manpower. The CM Development Fund is also working on the training of talents. At the end of this month, there will be recruitment exercises. There will be widespread publicity in relation to recruitment in the community. We want to engage more manpower interested in working in the CMH. Then they can apply for positions in the CMH. Next, Mr. Chen Kim-por. As Professor Chen said, in these 2 to 3 years, CM development is comprehensive. It is being taken forward at full pelt. We have seen progress in different aspects. From the commercial perspective, Hong Kong as a bridgehead in the internationalization of CM, this is very important. First of all, I recognize the government's efforts in taking forward this initiative at full pelt. There are some 8,000 CMPs in Hong Kong. You need a lot of manpower to take forward different policy initiatives. They may not be existing talents we have in Hong Kong. Among these 8,000 CMPs, do you have a breakdown when it comes to their ages? For example, how many of these CMPs are aged 60 or above? They may be satisfied with what they are doing. They may be already helping a lot of people, so they are satisfied. Some of them Well, I mean, we need younger CMPs who will work in the research and development area. Thank you, Mr. Chen. Yes, indeed, this is a very important point. CMH will provide not only outpatient services but also inpatient services. We need to develop more drugs, or we even need to develop GMCTI. We have R&D personnel in 3 universities, and I believe there will be greater demand in the future. As I mentioned, among the 8,000 odd registered CMPs in Hong Kong, we will look into their age brackets, for instance. We'll look into the distribution of these CMPs in Hong Kong. But we anticipate most CMPs provide outpatient clinic services in Hong Kong. So for inpatient services, we will identify room for improvement. The hospital authority has been in close liaison with the CM industry. They have sent a certain number of CMPs to our motherland to undertake training. They receive training in hospitals. We have 3 universities in Hong Kong providing CM programs. CM students go to mainland hospitals for practicum, internship, as well as training. Thank you.
A brief follow-up question. In the country, there is no lack of CM talents, so can they come to Hong Kong and practice? Yes, they can. Every year, among the new CM practitioners we have, some 80 were trained up by our own medical schools, and there are 200 CM practitioners who came from outside Hong Kong, mainly from the mainland, who can practice in Hong Kong after passing an examination. Ms. Judy Chan, thank you. I thank the Secretary for Health. So the 15-page long document detailed the developments of the CM industry in Hong Kong, and I think it is very positive. Now, my concern lies in women and children's health. Now, Integrated Chinese Western Medicine Services, or ICWM, it is mostly applied to chronic diseases, for example, stroke care, musculoskeletal pain management, and cancer palliative care. Actually, women and children receive a wide range of CM services, for example, infertility treatment or even ADHD treatment for children. Acupuncture or acupressure can alleviate these ADHD symptoms. So do we have a timetable or at least a direction on covering these treatments under the ICWM model? Secretary. Thank you. Ms. Chen. We are focusing the application of CM on certain disease types. For example, gynecology. Some CM practitioners are experts in the field. Now, in the future, Chinese Medicine Hospital, we will seek developments in these disease types, including gynecology and pediatrics, for specific diseases like ADHD. It depends on whether we have dedicated talents in these fields in the future. And then we can promote development of these specific disciplines in the Chinese medicine hospital. So for cancer, palliative care, and stroke care, will there be more collaboration between the Chinese medicine hospital and the public hospitals? Now, the ICWM model is being applied in the hospitals already. Now, for diseases where CM has an advantage, for example, cancer palliative care, stroke care, and musculoskeletal pain management, many of these patients are receiving CM services. Now, in the future, for disease types where CM has an advantage in and where there are a talent pool for the disease, we will promote developments in these disease types. Now, for the Chinese medicine hospital, there will be specialties in the field of gynecology, pediatrics, and orthopedics. Dr. Zhang? Now, we have 6 disciplines, including internal medicine, external medicine, gynecology, pediatrics, orthopedics and traumatology, and acupuncture and moxibustion. So these are the starting disciplines, but we also have focused discipline under various disciplines. For example, for gynecology, we have infertility and also perinatal treatment. For pediatrics, we have digestive diseases and other disciplines. So in terms of gynecology and pediatrics, the Chinese medicine hospital will offer a comprehensive range of services. Dr. Starry Lee, I'm sorry for being late because I have another panel meeting. Now, I thank the Secretary and his team for their support on developing Chinese medicine. This term of the government has done a great deal in promoting developments of Chinese medicine, including the blueprint and also the Chinese medicine hospital. Now, following up on Professor Chen Wing-Kwong's question, I thank the government for accepting the DAB's suggestion, including paragraph 30, where you will make use of Hong Kong's strengths in international trade to help bring our country's products to the world. So we will accept our proposal to establish a trading platform for Chinese medicine in Hong Kong. Second, reform in healthcare system. So like Professor Chen said, sometimes it is very difficult to get a quoted disc from the 18 Chinese medicine clinics come training and research centers. So what will you do to improve the situation? Secretary. Thank you, Dr. Starry Lee. As I've mentioned in my opening remarks, we will have the blueprint, the Chinese medicine development blueprint. Within the year, we will promote Hong Kong as a platform for bringing the country's CM products to the world. These will be mentioned in the future blueprint. Now, in Hong Kong, we have a primary evaluation system for Chinese medicine, unlike Western medicine. At present, the regulatory system for Western and Chinese medicines are different. For Chinese medicine, we are already implementing the primary evaluation system for Chinese medicine in Hong Kong. We will seek to introduce more quality, proprietary Chinese medicine products to be sold in Hong Kong and thus the world. In terms of healthcare system reform, and that would cover service quota of the Chinese medicine clinics as well as CM's role in primary healthcare. So can you tell me the timetable and will you speed things up? And one thing people care about the Chinese medicine hospital is the fee model and the manpower of the hospital. Now for the blueprint, the policy address mentioned that the blueprint would be available in the end of the year. We are now talking to the stakeholders. Now, the CM industry is very wide. It includes service providers, and on establishing a trade platform, more stakeholders are involved. Now, the blueprint will be delivered by the end of this year. In terms of the fee model for the CMH, as mentioned by Dr. Zheng, we are now studying various possibilities. One is a government-funded model. The other is a self-funded model. We expect we will have a preliminary design by September this year. Next, Mr. Michael Lee. Thank you, Chairman. I'm not a panel member, but I have been concerned about the promotion of Chinese medicine in Hong Kong, and I would like to put forward my views here. Now, I need to applaud the government for attaching importance to the development of Chinese medicine. In particular, the public has become more acceptive towards Chinese medicine services. Now, many young people have joined the CM trade, and there are a lot of Chinese medicine clinics in town. Now, they offer a wide range of services. Besides consultation and prescription, they also have moxibustion, acupuncture, acupressure, bone setting, and so on. And they come with a wide range of ancillary equipment. So in terms of moxibustion and other services, is there a regulatory regime that includes cupping? Now, a patient has no say on the person doing cupping or moxibustion on him. It may be an assistant, and accidents may happen if the therapist is inexperienced. Now, how can we promote quality Chinese medicine products from the country to the world? Now, there are lots of improvements lately. For example, in the past, we would be consuming the materia medica as a whole. Now we have a lot of good products. For example, the Ganoderma spore powder. Now, since we have such a world-renowned accreditation system, many products from the country have gained world recognition. For example, Chinese medicinal oil. Now, from our visits to mainland provinces, we understand that many provinces have their own specialties. For example, goji berry produced in Shanxi. Now, the quality is exceptional there. So can we have an accreditation platform to accredit these products? Can you leave some time for the Secretary to answer, or just very briefly? Now, can we organize some international events to bring CM products to the world? Now, I don't have much time left. In short, there is a regulatory authority for each healthcare discipline. For cupping and acupuncture administered in CM clinics, the CM practitioners are subject to the regulation of the CM Traders Committee. And same for the nurses. They will have to take responsibility for the services they offered. Now, in terms of He and CM research, like Western medicine, the basic research will be conducted in universities, and then the technology transfer office would transfer and commercialize the technologies. Now, the idea of the GBA International Clinical Trial Institute is to offer a platform to integrate the research process from research to clinical application. So the GBA ICTI would collaborate with the Shenzhen Park to speed up the development of CM medicines on clinical use. Now, in terms of accreditation, I would defer to Dr. Edmund Fong from the DH. Now, the DH has already sought to establish an internationally acceptable standard for medicine. Now, for Chinese medicine, we have the CM pharmacopoeia, which have set standards for some 300 CM materia medica. Now, there is a standard. There are standards in relation to the metallic pollution of the materia medica. Now, for CM traders, they can refer to the pharmacopoeia or the HKCMM standards for accreditation. Now, for proprietary CM products in Hong Kong, for example, medicinal oil and so on, we have also established a universal standard for these CM products in alignment with international standards. So proprietary CM medicines manufacturers can refer to standards set by us to gain accreditation.
Well, I'd like to supplement. Well, you've used up your time. Well, I'll have to wrap up this item as two other members pressed the button after 11:35. So I'd like to ask whether members support the technical amendments in relation to the Chinese medicine ordinance. If members don't object, we'll wrap up this agenda item. Let's move on to the next agenda item. Agenda item number 4. Hong Kong New Medicine Campus Redevelopment Project, construction of clinical training and amenities center. Let's first welcome the administration to join us. Other members are also invited to the discussion of this agenda item.
好，由於呢個議題係涉及公務建設。
This agenda item relates to public works proposal, so in accordance with paragraph 83A of the Rules of Procedures, if members would like to speak, please declare the nature of the relevant interest should you have pecuniary interest in relation to the item in discussion, be it direct or indirect pecuniary interest.
同樣我哋
Likewise, for members who are going to speak, please leave enough time for the administration to reply to you. Members who would like to speak, please press the button to request to speak now. And I'll give the floor to the administration. Please be seated.
好，咁我哋歡迎
I welcome Dr. Libby Lee, Ms. Elaine Mack, Professor Chan, Professor Chung, Ms. Chan, Mr. Jason Look, Mr. Gary Chung. Undersecretary, the floor is yours. Thank you. Together with the Education Bureau and the UGC Secretariat, as well as representatives from the Hong Kong U, we are going to brief members on the redevelopment project. It is the construction of clinical training and amenity center. We'd like to seek members' views. The government has been attaching a lot of importance to high-quality medical teaching infrastructures. We take great pride in it. We have been enhancing clinical structures in order to cater for the demand in Hong Kong. So in 2018 policy address, $20 billion were set aside for this project. In 2022 to 23 policy address, the government injected an additional $10 billion. The purpose was to ensure the successful completion of the infrastructural projects. In the past few years, there have been increases in the number of training places for doctors and nurses, so more space is needed. On number 6 Session Road, there's a project. This project aims to provide more space for students. 2 buildings will be built to provide more space for students. They cover clinical training center, student activity space, in order to provide more space for medical students. The project is expected to be completed by 2029, and we aim to submit the proposal to the Public Works Subcommittee and the Finance Committee. We hope to have members support this project. This project is very important. I'll now give the floor to the Hong Kong U to brief members on the project. Thank you. We have a PowerPoint slide. Yes. Good morning. I'd like to walk members through the the project. We'd like to seek members' views and support for the construction of this clinical training and amenity center. Several years ago, in the policy address in 2018, it was mentioned that we needed to expand professional healthcare training. To achieve this, we would have to further increase the number of related training places. The aim is in 2023, every year, we want to have as many as 800 medical students. In order to dovetail with this long-term goal, we need to have a campus development plan in order to increase and enhance teaching, learning, and student support facilities. There should also be more sufficient research facilities and offices for additional training or additional teaching and research capabilities. Number 6 Session Road is close to Queen Mary Hospital. There is Ho Sin Hung student hostels. We want to provide student hostels and space for medical students. Some more background information. Madam Ho Sin Hung Residence, it was built in 1992. It has a long history. When it was built, there were only 160 medical students each year. As time moved on, in September this year, with the support of the government, we are expecting an intake of 325 per year. In 2030, as I mentioned, the number of medical students will be increased. As we can see, in 1992 there were 160 medical students back then. Now, nursing students and medical students total 560. However, there's a lack of residences for students. The current number still stands as 160, and we will provide further information in a moment. As members can see, in the past few years, in the School of Medicine, the total number of medical students increased from 1,600 in 2002 to 2003 to 4,700 in 2024 to 25. It was an increase of about 200%. For teaching, student, and office facilities, it's not sufficient. So we still need to catch up. There are some pictures for members' reference. Please refer to the pictures. You'll have an idea of the actual circumstances. In Madam SHO residence, there are some 163 bed spaces. This building was built in 1992, so the facilities are quite old and cramped. On the left, you can see single rooms. The living conditions are quite cramped. You can also see study room as well as communal toilets. In 1992, there were 160 bed spaces, but right now we are admitting 325 medical students on an annual basis. At present, these medical students are residing in Patrick Manson residences. This residence was built in the 60s, much earlier than Madame SHO residence. There aren't any single rooms. There are double rooms or even triple rooms or quadruple rooms. As you can see, the facilities are quite primitive, so to speak, and it is high time we redeveloped these residences. Members can see the arrow in the picture, and you will see the actual circumstances of the residence. Senior year students will have to undertake practical experience in Queen Mary Hospital. Year 5 and 6 students will have to go to the Queen Mary Hospital for internships, or practicum rather. Queen Mary Hospital is only a few steps away. There are footbridges connecting the residence to the Queen Mary Hospital, which is just a stone's throw away. There's clinical training, for example, that includes medicine or other equipment. The conditions are quite cramped. So there are canvas beds for students to take blood pressure or to check the physical conditions of patients. And this situation is not ideal. Members can refer to the area marked in red. This is the student's residence. There are 3 existing halls not for medical students. For the area marked in blue, it is Madame SHO residence. And you can also see a restaurant or a canteen. And we want to remove this canteen and remove Madame SHO residence altogether. Then, the space available will be developed into Towers 1 and 2. They can accommodate as many as 700 students. For Madame SHO residence and Patrick Manson residence, they can provide a total of 270 bed spaces. As Undersecretary said, If members support this project in 2029, the number of bed spaces will increase to 700. But I have to say, this is not just about bed spaces. It also provides space for medical students to undertake clinical training. This is very important to medical students, so we will provide clinical training rooms. More resources will be devoted to providing clinical training for students. Medical students are under a lot of pressure, so we have different facilities to be provided to students. There are also different rooms, such as student amenity facilities as well as supporting facilities. Students can receive support from clinical psychologists as well as counselors. Well, we need 2 more minutes. Members can see the appearance of the buildings. You can see towers 1 and 2 in the picture. Upon commissioning of the Clinical Trial and Amenity Center, there will be clinical skill training room as well as communal area, and I'm not going to go into details in relation to student wellness consultation rooms. Regarding the implementation timetable, we anticipate to submit the proposal to the Public Works Subcommittee meeting and to the Finance Committee in June 2025. The works are expected to commence in the 3rd quarter of 2025, and they are slated for completion in the 3rd quarter of 2029. 6 members have pressed the button to request to speak. Owing to the time limit, if you want the administration to reply on the spot, please allow time for the administration to respond to you. Otherwise, they will have to provide written replies to you. 3 minutes, questions and answer included. I will draw a line after the first member speaks. Mr. Michael TIEN, Ms. Zhou Chen, Mr. Chen Pui Lam, Ms. Connie Lam, Mr. Chen Haofeng, Mr. Peter Xu, and Mr. Benson Lok. Mr. Michael TIEN, please.
Thank you, Chairman. Now, in 20 years' time, the number of medical students has increased by 200%, but the residence space for students have only increased by 20%. So, of course, I would support this proposal. It would be a shame if we don't treat our talents properly. Now, about the International Innovation Center to be built in Pok Fu Lam, the government said that there was no objections during the consultation stage, but then when it came to the electrical, everyone was objecting to it. So you said that you have consulted the stakeholders. Of course, they would not be opposing your proposal because they are the beneficiaries. Now, if you look at the site, now 58 meters away from the site, there are some private residential developments. It's within 100 meters distance from the construction site. Now, this is a very short distance. Have you consulted the residents in the 2 private residential developments about this major project? Otherwise, there would be controversies. Professor Chen. Now, we have notified the residents in the Bailey Garden and the other estates that there would be a development program. Now, on the construction site, there are 3 student residences with some 1,000 students living in them. So there will be a lot of nuisance caused to the students. We have notified the students beforehand that there was going to be a development project. Now, the International Innovation Center was strongly opposed by the nearby residents. Now, the Bailey Garden and the CNT Business is just 58 meters away from the construction site. Have you consulted these residents? I will defer the question to Mr. Ho. Thank you. We haven't consulted the residents there yet, but we have been. So I have 10 seconds left. I just urge you to consult the residents right away. In my constituency, the International Innovation Center project, it was 100 meters away, but the residents still strongly opposed to it. Ms. Jovi Chen. Thank you, Chairman. Now, the number of medical students in the HKU has increased from 1,600 to 4,700. That's to meet the future healthcare manpower needs. However, the teaching facilities have not caught up with the increase in the number of students. So on the premise that the construction project causes no major disruption to the living environment and the teaching quality, we will support the proposal. Now, with the limited space at the campus, the existing Madam S.H. Ho residence has to be demolished for building 2 new buildings. But I'm surprised. On the 19th of April 2023, a consultancy report was published. But I can't believe that you haven't consulted the residents nearby. The construction project will give rise to a lot of nuisances. For example, more vehicles coming to the areas and noise and air pollution. So how can we ensure that the students' learning quality is not affected? Now, there will be 700 new beds offered in the facilities. Now, there are only 277 beds as the Sassoon Road premises now, so there will be an increase of 400 beds. So will that be able to cope with the increase in the number of students? If not, how can you justify that more than half of the floor space of the 2 new buildings are used for students' amenities but not for providing more beds? Will that exacerbate the gap? Under Secretary. I will speak first and then I will defer to Professor Chan. Back in the 2018 policy address, we mentioned short, medium, and long-term development plan for the HKU. This is just the medium-range plan. There are going to be more long-term plans to meet the needs of the Hong Kong U. Professor Chan. Thank you. Now, Ms. Chan's question was whether the 2 new facilities would be sufficient to meet the future needs. We think so. Now, only 5th and 6th year medical students, in other words, senior students, would require the facility. Now, back in 2018, we had a short, medium, and long-term expansion projects. Now, for the short-term expansion projects, it was completed by the end of last year. We are now moving on to the medium-range plan. Now, with the support of members, we will be able to provide quality learning space for our students. Mr. TIEN Puk-sun, thank you. Now, this proposal is about redevelopment of the Clinical Training Amenities Center. But this is mainly for addressing the shortage of bed spaces for medical students. Now, the price tag for this project is $1 billion. Now, is that a bit too steep for building student residence and amenities center? I know there will be some clinical training facilities. So does the $1 billion price tag cover these training facilities as well? Now, must medical students live in the students' residences to learn medicine? Now, medical students must reside in a student's residence. That may be something in the past because the transportation network was not as convenient as today's. So is it still the case that medical students must reside near the teaching facilities? If not, can we rent a place nearby to offer residence for medical students? Will that be more cost-effective? Under Secretary, I will take the second question and then defer to Professor Chen. And on the second question, I will defer to Mr. Look. Now, as the chairman may be aware of the fact that senior medical students need to live within the hospital premises, but that would be undesirable because that would take up clinical spaces in the hospital. Now, we would like to expose the senior medical students to more types of cases which may arrive out of office hours. Now, in terms of construction costs, I would defer to Professor Chung and Mr. Look. Professor Chung, thank you. For senior medical students, they need to work shadow the doctors. And we all know that the cases, the patients, at nighttime are very different from those in daytime. So a group of students will be following the residential doctors to learn how they handle these cases. Now, the Madam SHO residence is rather small. When I was studying in school in the 1990s, we did not have handheld ultrasonic device. Now, every medical student is equipped with a portable device. Now, to conduct a chest or abdominal check, there is a standard for space required. Now, for stitching, say for example, because of the lack of space, some students need to practice stitching in pantry using pork meat. Now, of course, we would like to provide them with the best facility available because in 10 years' time, these will be the mainstay in the healthcare system. So we urge members to support the expansion scheme. Now, on construction cost, the price tag is $1.45 billion. Now, there is a comparable student residence in the CUHK. Now, the per unit construction cost was some $25,700. Now, for our project, it is $22.9 thousand. So we are 9% cheaper than the project back in 2015. And also, we are adopting the MIC. For the Wang Shouhang project, we adopted the MIC model, but this time, our price tag is even 20% cheaper than that project. That shows that we have exhausted our means to compress the cost. And also, originally, the project would take 6.5 years. Now, we have compressed the two-phase projects into one phase and aim at completion within 4 years. Now, even without taking inflation into account, we have already achieved a significant saving. Ms. Connie Lam. Thank you, Chairman. Today's proposal is about spending $1.45 billion to build a clinical training amenities center for medical students in the HKU. So we support the general direction. Now, the Sassoon Road campus is lack of space. In particular, it lacks well-being and psychological amenities for students. Now that would be a bit. However, even with this proposal, the student wellness consultation room will only be available in 2029. Now, the doctor said just now that some students need to practice stitching in the pantry. That is very unsatisfactory. So will the government, or will the HKU build some temporary amenities facilities, for example, student study room and multipurpose room for the medical students, so that they don't have to wait until 2029? I know some young medical students and they are under immense stress, so can we provide them some help? Now, I thank Ms. Connie Lam for your support on provisional facilities. May I defer to Professor Zhong? Thank you, Ms. Lam. Now, psychological support for medical students is very important. Now, we have several rooms in the residence for professional counselors to talk to the students. Now, with the redevelopment plan, we have talked to the relevant departments whether we can maintain the provision of these services during the construction project. Now, I really hope that there would be relevant spaces set aside for these purposes during the interim. Now, I thank the LegCo for your support. As I've mentioned, we have short, medium, and long-term plans. During the short-term phase, we received $100 million in 2023 to expand the residence. Now, in terms of psychological services, we will be able to provide the services as the main building and then move them back to the hall in 2029.
Thank you. Mr. Chen Hokfeng, I'm not a member of this panel, but this is in my constituency, so I'm joining the discussion today. Well, basically, this project is in my constituency, but then district councillors weren't consulted. Well, you're saying that local residents aren't affected. This will, however, affect local traffic flow. It will also affect traffic for students. I'd like to know how you will enhance communication and consultation with local residents so the council will be able to act as a bridge between the administration and the community. Transportation is very important. Queen Mary Hospital has been redeveloped. There will be a lot of footfall as a result. Much of the footfall rely on the MTR to be connected to the hospital. As I understand, Kennedy Town MTR station isn't connected to any minibus stop. It is good that you are now using footbridges to connect in different places, but after all, you'll have to study the situation more. How are you going to minimize nuisance? Every morning, near Kennedy Town Station, there are coaches carrying Hong Kong U students to Sabaport. And this has a huge impact on local residents. You need to talk to the council. You need to undertake a consultation. It is not the case that you're saying that there won't be any impact. We are running a fiscal deficit. Well, the University of Hong Kong has the means. Will you consider not seeking money from the administration, from the public coffers? We're in the red right now. Well, mainly the residence is for senior year medical students. They need to walk up to the hospital. So there isn't much impact on local traffic in Kennedy Town. But I understand this is an important project in the district. So we need to consult the district council in the area. Regarding whether Hong Kong U can pay for this project, I will defer to the Hong Kong U representative. Thank you. Regarding our communication with the district council, we report to the Southern District Council every 3 months. We met with the chairman of the panel on development. We explained our planning in the short, medium, and long term, and we've had the support of the chairman of the panel on development. We will enhance communication with the district council. Thank you. Just now, a member asked about the financial aspect of the project. I can give you some information. In the past 4 years, on Sasson Road, Hong Kong U has paid around $7,500 million. Yes, indeed, $750 million to construct buildings and so on. Another figure for members' reference: in the past few years, Hong Kong U set aside some $4 billion on different expansion projects of the campus. In the coming few years, we are expecting the expansion project of the entire campus or the university. It's about $10 billion. Next, Mr. Peter Schill. Thank you, Chairman. It's about the construction of clinical training and amenities center. I'd like to ask the university, do students have lessons in the center, or do they have lessons elsewhere? Well, basically, there are a lot of different places. Of course, when they need to meet with patients, they'll go to the hospital. But then, as Professor Zhong mentioned, for ultrasound checkups, medical students will have to practice beforehand. They practice with medical students. They practice with each other. So they need a simulated environment for them to have practice before doing it on the patients. And for stitching, for example, they have practice with a piece of pork, for example. So you mean they have practice? Say, when I was a student, I looked for a table just at home. Is it that simple? No, it isn't that simple, Professor Chung. There are regular classrooms, standard classrooms, for students to practice. Practice makes perfect, as we often say. So what about after class? How do they practice? Junior students and senior students will have interactions and exchange with one another. Say stitching, this is one of the examples. Well, you said it is a clinical training and amenity center, as I can see in the papers. But actually, much of the space is for residents, say 700 bed spaces. Is that for accommodation? Well, if you refer to a PowerPoint presentation, 6,000 square meters are for residents, whereas 5,300 square meters are for teaching and learning facilities, say clinical skills training room to train the dexterity of medical students. Well, do they practice on their own, or are there teachers? Well, not just teaching. Actually, for first aid, for example, they need different equipment and facilities. So for different specialties, different facilities are required. For teaching staff, and the teaching timetable will have to have regard to the curriculum arrangements. Students practice on their own. Just like for university students, they return home when they do revision and they discuss with their peers when they have to work on projects. But now you're setting aside some places for students. Well, when we used to have financial means, there weren't as many questions. Do we really need students' residence just right next to the campus? It just takes a short time before for students to go to the Western District. Students can walk to the Kennedy Town. In Prince of Wales Hospital in Sha Tin, students are residing inside the hospital. Well, you could look for places just right next to the hospital for students to reside in. I'm not sure why you need to have residence just right next to the hospital. As I can see, students' facilities are aged. I wasn't consulted, so must I support this project? Is that the case? Must I support the project? Well, please provide written response. Thank you, Mr. Benson Locke. Thank you, Chairman. In the past 2 decades, School of Medicine students saw a twofold increase, whereas the increase in facilities and floor space was only 20% or 50% respectively. Medical students need to practice teaching on a piece of pork, and I can see the perseverance of medical students. They do need tools to practice, but I'd like to seek clarifications from the administration. About $1 billion for this project. Has the university studied other alternatives in relation to financing options apart from seeking money from the administration, say from the reserve of the university, or fundraising or financing from banks? Have you considered other alternatives? Every year, Hong Kong U will offer 325 medical training places. And as I understand, there will be second degree of medical training. It will be provided soon. Upon the commissioning of this project, do you have capacity to further increase or to further expand the number of medical training places? And a more technical question. For the design of this building, have you already used up the plot ratio, or is there still further room to increase the plot ratio? For university expansion projects, oftentimes universities say that they run out of space after a handful of years. For the Centennial Campus expansion project several years ago, there wasn't much consultation. For neighboring housing estates, they have a lot of different views. Say for the facade of the buildings, the reflective windows affected them quite a lot. So I hope Hong Kong U will continue with consultation regarding the district councillors of the BPA. I can help with connecting you and the district councillors in the area. Overall, universities can emit 400 medical students with the redevelopment of the center. I thank Mr. Benson-Look for your view. We will fare better in consultation regarding plot ratio. In my answer to another member's question, in the past 4 years, especially for the School of Medicine, about $750 million were set aside for the construction of a building. In 2023, as mentioned in the Legislative Council, $130 million were spent on expanding MMW building. Some funds were set aside for the expansion project. There are still a series of expansion projects, so we did use our own funds to enhance teaching and learning facilities. Regarding measures in the short, medium, and long term, well, you have already covered these questions. Regarding the plot ratio question, just a simple answer of yes or no. Well, indeed, we want to maximize the plot ratio. About the background, in 2010, we conducted TFS, Technical Feasibility Study, comparing with the current version minus 2,800 GFA. We have to observe a lot of provisions in accordance with the building's ordinance, say the building setback, and so on. So for the current proposal, we have increased 2,800 or so, so we have already used up the space that we can use.
Thank you. So members, do you support that the government submits this proposal for the scrutiny of the PWSC? I agree with the direction, but I don't agree with the price tag and also the consultation approach. So what should we do? So anyway, do you support the government submitting this proposal to the PWSC? Should I just state my stance orally? Well, it seems that we don't have any objecting views, so we support the submission of this proposal for the PWSC's consideration. The last item, updates on human papillomavirus vaccination catch-up program. We now invite the government official to come in. Members who would like to speak, please press the request to speak button in front of you. Again, if you would like to hear a reply from the administration, please leave the government some time.
Now,
before we start, I will extend the meeting by 15 minutes to 1 p.m. Dr. Lip Lee, please. Thank you, Chairman, and thank you, members. Today, we are updating members on the HPV catch-up program, or HPV vaccination program. Now, besides the Health Bureau, we also have the Education Bureau with us to reply to members' questions. Now, cervical cancer is one of the top 10 most common and deadly cancers among women in Hong Kong. According to the WHO's recommendation, in 2019 to 20 school year, the Center for Health Protection has launched the HPV vaccination program to primary 5 and primary 6 school girls under the Hong Kong Childhood Immunization Program. In other words, we have been vaccinating primary 5 and 6 students. Now, since then, 90% of eligible girls, or 97,600 girls, have completed 2 doses of HPV vaccination. So like other vaccination under the Childhood Immunization Program, HPV vaccine have achieved and maintained a very high vaccination rate, greatly reducing the occurrence of cervical cancer. Now, according to the views and recommendations of the Scientific Committee on Vaccine Preventable Diseases under the CHP, the government has decided to launch a one-off HPV vaccination catch-up program by phases to cover female Hong Kong residents who were born in 2004 or after and have not been covered by the HKCIP. The program will be conducted in 2 phases to benefit some 190,000 eligible female. Now, the program has started on the 2nd of December 2024. The program covers all full-time female students studying in Hong Kong secondary schools. The school can engage participating outreach private vaccination teams to provide free HPV vaccination service to the students. Now, the CHP would provide free vaccines for the outreach vaccinations along with a subsidy of $105 per dose to doctors. Now, if eligible female students miss the outreach vaccination activities at school, the Student Inoculation Team Sub-Office and Students Health Service Centers would provide mop-up vaccination. For those schools in remote areas or schools which cannot identify an appropriate service providers, the SIT would also provide outreach vaccination services to the schools. Now, for those female students who have already graduated during the second phase, they can receive the second dose at their post-secondary institution or university study. Now, parents can save the cost for getting their daughters inoculated in private clinics. Now, for the 2 doses, it would cost $2,400 to get the 2 doses of vaccines. Now, with our efforts, 95% of the eligible schools have signed up for the program. Now, for mop-up vaccination, for the first dose, 76% of the eligible female students have received inoculation. As at the 9th of March, more than 500 schools with eligible female students have signed up for the program, and 8 have yet to sign up, and 7 have yet to reply. Now, the Health Bureau and the Education Bureau will reach out to these schools one by one to understand the difficulties and provide them with assistance. To encourage inoculation among female students, we have adopted a series of measures. For example, sending letters to all secondary schools as well as to parents, and also organize online and in-person briefings. Now, as at the deadline for reply from schools, that is the 31st of March this year, the Department of Health will request schools which will not arrange outreach vaccination activities to issue a notice to inform parents about the school's arrangements. And also a list of these non-participating schools will be uploaded to the CHP's webpage so that parents can arrange their daughters to receive mop-up vaccination at a SIT sub-office or a Student Health Services Center. Now, second phase and third phase of the program. The second phase will begin in March this year. The targeted recipients are female Hong Kong residents studying in local post-secondary institutions or universities who were born between 2004 and 2008. Participating institutions could choose to provide catch-up vaccination services to the students at their healthcare services clinics or arrange outreach teams to provide service on campus. The CHP would provide free vaccine along with subsidies to doctors. As of the 2nd of March this year, around 70% of the institutions and universities have enrolled in the program. We are actively following up with institutions that have not yet responded. The third phase will begin in the first half of 2025, targeting female Hong Kong residents born between 2004 and 2008 who have already completed their studies in Hong Kong. The third phase will also cover the rest of female Hong Kong residents born between 2004 and 2008 who have not yet received their second dose of HPV vaccination. So that's what we call the mop-up vaccination. The CHP is working together with the Primary Health Care Commission to finalize the arrangements of the third phase. The mop-up vaccination services will be provided as district health centers and the district health center express. Now, HPV vaccination is very effective in preventing cervical cancer. I hope all eligible female residents would make good use of this program. Otherwise, you will have to pay out of your own pocket at the cost of $1,500 per dose. Thank you. Now, please refer to the letter dated the 13th of March from Ms. Elizabeth Quartz concerning this item. Now, the floor is now open. Professor Chen Wing-Kwong, 4 minutes, including questions and answers. Thank you, Chairman. I support the government's efforts to launch the HPV vaccination catch-up program to prevent the occurrence of cervical cancer. This is a good policy aimed at protecting residents' health. Now, to receive a HPV vaccine dose at a private clinic is very expensive. It can cost north of $1,200 per dose. So since the HPV vaccination program was launched in 2019-20 school year, how much has the government spent on the vaccination program? And what is the estimated budget for the mop-up vaccination program, including the procurement of vaccines and also the subsidies provided to doctors? Now, paragraph 10, among the schools which have already received the vaccination, the coverage rate of the first dose of vaccination was 76%. In other words, 24% of the female students have not received the first dose. So does the government know why these students were left out? Now, vaccines are very effective for preventing cervical cancer, and it is free of charge. Now, some students outside Hong Kong are willing to come to Hong Kong to get vaccinated by paying for the vaccination themselves. However, some local students are missing out on this opportunity. So do schools and parents understand the intention behind the vaccination program? Now, according to the paper, there is still 5% of eligible secondary schools and 30% of eligible post-secondary institutions not sign up for the program. So why are these schools or institutions unwilling to sign up for the program? Now, in the past, there are some schools who did not sign up for the vaccination program for influenza. So will the Education Bureau and the Health Bureau encourage more schools to enroll in these programs which are beneficial for students' health? Thank you. We will supplement the data on the expenditure after the meeting, and I will defer the other questions to Dr. Leung. Thank you. On why the coverage rate is just 75%, we have asked schools about the reasons. Now, some students were worried about the upcoming DSE examinations, and some students were worried about the possible side effects of vaccination. Now, we have heard members' views, and we have stepped up promotion. Next week, on the 19th, we will organize an online briefing for parents. We have invited gynecologists from the Department of Health as well as other doctors to explain the benefits of HPV vaccination and answer parents' questions. Now, the targeted groups for the vaccination are mainly young persons, so we will launch a promotional campaign on social media. We have filmed promotional video clips featuring our gynecologists to clear up misunderstandings and encourage more students to be vaccinated. Now, in terms of encouraging schools to enroll in the vaccination program, our efforts have been detailed in paragraph 8. Now, since October 2024, we have done our best in encouraging schools to enroll in the mop-up vaccination program. Mr. Peter Shield, Chairman, do we need to vote on this item, or are we just being consulted? So we're just being briefed on the program. Fine. So my question is, how many school students need to receive vaccination in their lifetime? So does Mr. Peter Shield mean that in the childhood immunization program, how many doses each student needs to receive in each school year? Dr. Leung? Now for primary 1 students, our school immunization teams would offer the measles vaccines, the second dose of measles for primary 1 students. However, several years ago, the timing of immunization was changed to 18-month-old. Now, because of the time gap, there are still groups of students who need to receive vaccination. Now, for primary 5 students, students need to receive the first dose of the HPV immunization, and the second dose in primary 6 students. And also, there are top-up vaccines for type B hepatitis. So altogether, maybe 6 doses. That includes a DPT vaccine as well. So, would you brief us on the progress of each vaccination program? Today, we are briefing members on the HPV vaccination catch-up program because a member asked why there was such a low take-up rate. So that's all because of Ms. Elizabeth Kwok's question. Now, vaccinating our students for prevention of disease, of course, we will support you. Now, like Professor Chevin Kwong said, there are many people from the mainland who come to Hong Kong to get the vaccination by paying on their own. So we would definitely support the free vaccination program for our female students. Now, there is still many students who are left out, and 5% of schools have opted out from the program. Do you understand why?
Among these 500 schools, 7 schools haven't yet replied to us. 8 schools rejected us. We have already talked to the schools. Dr. Leung can give us more information. Thank you. The major reason is that schools have a packed curriculum. A minority of the schools put forward religious grounds. Well, for religious grounds, what about measles vaccines or for other types of vaccines? Well, we'll have to look into the situation first. Well, I think you need to look into the situation for the remaining 8 schools which rejected you. Did they put forward religious grounds as well? You need to see whether they only reject the vaccination of HPV. You will also have to liaise with the Education Bureau if they have a very packed curriculum, so much so that they do not allow students to get vaccinated. Well, I don't think schools are in a position to not allow students to get vaccinated. You will have to liaise with the Education Bureau. You need to talk to the management to gain an understanding of the situation. Well, I thank Mr. Peter Shield for your views. Any more members who would like to speak? No, let's wrap up this item. AOP, any other business? There being no any other business, meeting adjourned. Thank you.